Hi, everyone. Welcome back to the Human Narrative. This is your host, Dorinda. It is always a pleasure to be back and to be able to connect with you and see how life is treating you, how life is going, and also give back to the community in whatever form through information, resources, and even love and respect, and even in the way of comedy. Might not be comedian in any way, but I hope that you had a beautiful week. And if your week or days were not so beautiful, that it's intentional for you to be able to create that space for yourself in the upcoming week, to come, or weeks to come. But as stated, welcome back to the Human Narratives. It's also a pleasure to be here. And today I wanted to talk about, one of an area that I find very passionate about, of course, mental health. And the topic today is on schizophrenia. And this is a mental health disorder, of course, that is normally diagnosed by a mental health provider, a psychiatrist, and of course, this condition is a chronic condition. But there are, of course, people who sometimes, or family who become aware or start experiencing symptoms, who may not always understand what's going on. I've even heard families who assume that there's going to be a cure, and they can't wait for it to be a cure so that they can go back to life and things would just be all right. And then have to be able to communicate this harsh reality that this is not something that has a cure. This is a chronic condition and a severe mental health disorder that affects how a person thinks, how they feels, and also how they behaves as well. And it is characterized by episodes of psychosis, including hallucinations. And this is when someone is seeing, um, or hearing, right? Things that aren't there. So delusional beliefs as well, and also disorganized thinking and impaired or social functioning. So there's a lot that that come with this disorder, as I just talked about, just being able to describe what it is. So just imagine, as someone who is diagnosed with schizophrenia, how that person may feel, on a day-to-day basis, versus someone who is also there, not understanding and trying to support. It can be very, very, very challenging. And sometimes people and families, who are in this space, are at loss and do not know what to do, because this system does not always have that permanent fix, right? Or that permanent support. It's always just temporary, or stabilization, as we often term it in the treatment world. It's often about stabilization. So let's talk about what are some of the symptoms of schizophrenia. So symptoms are generally characterized into positive and negative and cognitive symptoms, right? So some of those symptoms, or positive symptoms, may include normal behavior that one may not even um, characterize as a symptoms, or as a symptom. Hallucination, as I mentioned earlier, where one may have auditory hallucination, or auditory, this is where someone is hearing things, that may not be present to someone else that is also in the current area, or space, or they may describe it to you that they're hearing things, right? Or it may be visual. This is when someone is seeing things, so their auditory hallucination and their visual hallucination. And there are other sensory experiences too that aren't real, right? So just because someone is diagnosed with schizophrenia, it doesn't mean that they may experience auditory and visual. They may experience both. So please try to understand what that person is, you know, expressing to you, to better support them in the space that they're in. So despite the hallucination, what are other things that also happens? Let's see. Then you have the disorganized speech, right? So this is where someone is having difficulty with their thoughts. They may be jumping from topic to topic. And it may be sometime even in fast pace, right? And then you have the delusional thoughts as well. This is or a belief. This is where these are things that are not in reality based, and there are many ways you can describe that, and I don't want to just come up with just any type of reality, not reality based example, because at the same time I want to be able to be respectful as well to those who are diagnosed with schizophrenia and this mental health disorder, to um, be able to describe it in a way that respect those individuals as well, right? So then you have the disorganized or abnormal motor behavior, right? And then there are also negative symptoms, the diminished abilities that one may experience in their that they may not normally experience when they are, going through an episode or psychosis. There's also social withdrawal, and there's a lack of motivation. There is this decrease in the ability to experience just pleasure, just to be able to enjoy things in life. So basically it's going to come with some sense of depressive symptoms, which one may experience, and also cognitive symptoms, right? Cognitive impairment. The things that one may once used to do, it may not be they may not able to do that anymore. Maybe they may not be able to drive, or they may not be able to bathe themselves. Something as simple as those things that we normally do on a day-to-day basis, and sometimes even take for granted at times, right? So impaired memory and attention, over time, individual who are not taking care of themselves, who are diagnosed, or even people who are, may experience, cognitive impairments. It may worsen over time as a result of the diagnosis. Difficulty with problem solving and decision making may also come up, and focusing or trouble focusing or following conversation as well. May be a symptoms. The disorganized speech was one of the thing that of speech was one of the thing that I mentioned earlier, as well. So this condition, like I mentioned, is not something, or this diagnosis is not something that, one who is diagnosed with um, can easily just say, I'm okay every day. They're not going to be okay every day. The expectation of them being okay every day, it's something that you hope for, and that's something that we should also support them towards, right? But it's a constant work and support as well, because that's a huge component, support. But what are the causes and risk factors of schizophrenia? The exact cause of schizophrenia is unknown, but it is believed, of course, to come from a combination of different factors, and those factors may include genetic, and it may include biological and even environmental factors as well. And then, when we're talking about genetic factors, These may include like family history that is passed on the line, and this increases the risk as well. Also, um, our brain chemistry, right? Our brain chemistry changes and the structure of it changes, where there is an imbalance of the neurotransmitters, like the dopamine, or dopamine, right? Excuse my word, the dopamine and the glutamate. And all of those imbalances causes the structure of the brain to maybe react or respond in a different way than we may normally, you know, get used to, or experience that individual. There was a documentary watching the other day about Patty Page, who went through those similar experiences. You guys should check it out. And then, have discussion and bring your feedback about that. But yes, that can happen in real life. Even stress can causes some form of brain, chemistry and structure imbalance. So that's why it's really important to, take care of yourself, take care of your body, take care of your mind, take care of your soul, being around things that feeds you and that feeds you in a positive way, and that you can feed back in a positive way. Because if not, all of those things adds up. There's a book that says the body keeps scores. Our body holds the things that we experience each and every day in our lives. So it's really important that we are mindful of what we're inviting, to make sure that you take care of yourself, so that you eliminate a lot of those stressors that we can prevent it, but trying to make sure that you don't experience all of those things that life stressors tends to bring about on a day-to-day basis. So there's also environmental factors. So, what are those environmental factors? So, prenatal exposure to infections, stress, as I mentioned earlier, drug use. Sometimes there are people who, certain types of drugs can cause someone's brain chemistry to change, right? As a result, that can also impact one risk of being diagnosed with schizophrenia. What are the diagnosis and treatment? That's important. A lot of times, you know, there are people who say, I don't believe in medication and I want to explore these different options. And you have your right to do what you understand is best for your body, for your soul, for your mind, for your spirit, for yourself, for your family. Um, at the same time, being also honest with yourself about how your body, spirit, mind, soul feel. And if the things that you're giving it to be able to heal is not working, please, seek other resources that are out there, to see how those resources fit in supporting how, whatever you're experiencing, so you can feel better, so you can enjoy life. Because I always tell people, whether you're diagnosed with schizophrenia, whether you're diagnosed with bipolar, whether you're diagnosed with anxiety, depression, whether you're diagnosed with, ADHD, any of the mental health disorder, or even learning disabilities, or even health condition, diabetes, and all of those things, those diagnoses are not your life. You still have a life to live. That is something that, you have to maintain and take care of, but we cannot allow it to become our life. You still have to be able to live life and enjoy it. And that is still possible, right? So, diagnosis and treatment. So, schizophrenia, the diagnosis, of course, is based on an evaluation. As I mentioned in the beginning of this podcast, was that you can, see a psychiatrist, a mental health provider. So, this is done through evaluation. Once you meet with a psychiatrist, you will conduct a clinical, you and the psychiatrist, or the psychiatrist will conduct a clinical evaluation, um, have to make sure that I'm explaining so other people can understand, not just for me, right? So the psychiatrist will complete a clinical evaluation, and they will try to understand about the symptoms that you've been experiencing in the last 6 months. And this may include like antipsychotics medication. You may talk about those type of things, which may help reduce the symptoms, particularly the hallucination and also the delusional thoughts, right? The hallucination and also the delusional thoughts as well. And then they may refer you out to see a psycho to complete or start a psychotherapy with a therapist, right? But let's talk a little bit about the evaluation with a psychiatrist. There's many things that will happen there. A lot of times people get nervous when you're meeting a psychiatrist or a mental health provider for the first time. Ask questions. This is your space and you're paying someone to be there, right? And you understand what is going on better than anybody else, better than the providers. Yes, they're educated. Yes, they know what they're doing as well. But if the both of you can come together and educate each other, then you can be in the better space when you're well supported. So if your needs are not being met when you go to these appointments or offices, change a provider. You don't need to keep the same provider if it's not working for you. Okay. But when you do go there, or if you feel nervous about going to these different spaces, ask questions before you get there. When you get there, take someone with you that you feel comfortable with. Ensure that they sign the consent to be there. But don't be afraid. This is your space, and it should feel like a safe space. That is going to be very important, right? So, once that is all done, you meet with a psychiatrist, maybe a medication or antipsychotic is prescribed. Then they will refer you or might refer you to a therapist. So, this is where you will be meeting maybe with a therapist to complete a psychotherapist, like a cognitive behavioral type of therapy to kind of help manage the symptoms and improve your coping skills over time, right? So you may use different type of intervention techniques to be able to do so. And your therapeutic setting should also feel safe. Whatever provider you're meeting, should feel safe. And if that connection doesn't feel safe, find someone else. I'm not saying abuse the space either, right? But find someone that works well with you. And when you're meeting for therapy, it can be once a week, twice every other week, every 3 weeks, once a month. It all depends on what your needs are in the time that you're seeking therapy, because it changes over time, right? And if it changes, if you're meeting once a week, but things are getting better, you need to reduce it to twice a week. Then that's okay, as long as you're honest as well when you're in that space about what you're experiencing, so that your provider can best support you and the both of you can be in a better communication about what's going on, overall, right? And then social support. I mentioned earlier about how support is very pertinent in any diagnosis that one may be experiencing. So social support, there are rehabilitation programs, there are support programs, there are employment programs, there are family educations that can improve the overall quality of life as well. Schizophrenia is a lifelong condition, but of course, when one have the proper treatment and support, many people can manage their symptoms and be able to live a fulfilling life. Like I said, this is a condition. It doesn't mean that they have to take away from living, but we also get to make that choice, based on how we take care of ourselves, our body, when one is diagnosed. So, what are some of the community resources for patients that are out there? So, community resources play a crucial role, of course, in being able to support individuals who are diagnosed with schizophrenia, and being able to have access to treatment, being able to have access to housing, being able to have access to employments, not just treatments. They still have day to day existence, right? Things to be able to live, because when one is diagnosed, it does impact being able to show up every day for work, being able to maintain housing. So all of those type of things are going to be pertinent, very important, to be able to have access, case management staff to support individuals who are in these spaces, right? Housing, employment, social support. Some of the resources in our community, of course, in the area, are the mental health support services like the National Alliance on Mental Illness. And this they offer a range of support groups, education programs, advocacy for individuals with schizophrenia and their families. There's also the Substance Abuse and Mental Health Service administration. And you can go to these website and check out their resources. They provide a treatment locations for the different mental health locations and services and facilities where they provide those different services and support, right? Your local mental health centers or your local mental health authorities, each, when if you live in different cities or different states, check out your local mental health authorities. They have a lot of mental health resources that are available to you. Harris Health is one. MHMRH is the one that we have here in the Houston area. So there are many different that in different areas that provide counseling, medication management, like I mentioned, also case management if there are areas of one's life they are not able to manage. Housing and living support. So for housing and living support, as I mentioned earlier, you can go to like the housing and urban development programs, which offer like subsidized housing for individual with disabilities. It also support housing programs, and many local organizations provide group homes or even independent living if one is not able to live on their own. As well, you can live in a group home, and be able to receive the mental health support and resources and be able to have that connection with other people as well, so you're not isolated, right? As mentioned, the National Alliance for End Homelessness and can help connect individual mental health resources and housing resources as well. When it comes to employment and vacational support, people want to make their own money. They don't want to depend on someone else. So whether they're diagnosed with mental health or not, to be able to have that independence, because that is their life, right? It's not about someone being diagnosed and then you just taking over and trying to control it. Especially if they're still able to do a lot for themselves. We want to be able to empower them to do so. So the vocational rehabilitation services, it is available in every U.S. state. They help individual disabilities, including schizophrenia, and find mental to be able to find and maintain employment. They also support a lot of different employment programs and have mental health centers that offer job coaching and placement assistance. The clubhouse model programs, that's another resource someone can look at, if that's something that kind of is in alignment with the services that you're looking for. It provides a lot of community-based opportunities and surrounding mental health, right? Crisis and peer support services, 988 suicide and crisis lifeline. You can call 24/7 to be able to receive support and talk to a live clinician or text a clinician as well. These individuals are experienced clinicians with mental health expertise. There are also warm lines that are available based on your interest. Warm lines if you are a Christian, or if you, domestic violence, those type of, different areas of things that you maybe want to just focus on or receive support in those different areas. There are warm lines that are available in those different things. Non-emergency peer support lines are also available, even groups, right? Peer support groups, um, depression and bipolar support lines. That's one a support group. A lot of those resources that I mentioned earlier in the community also provide support groups as well. Legal and advocacy resources, right? There may be times, one may want their family to support them when they are not able to provide decision or make decision on them, their own about themselves or on behalf of themselves. So they may designate a safe family member to be able to do so. So one may need a legal advisor to complete a legal guardianship paperwork or whatever the case may be, right? That's just an example. So there are legal resources out there that are supportive as well, protection and advocacy for individual mental illness. They provide legal assistance for individuals facing discrimination or even inadequate care. The Social Security Disability Insurance and Supplement Security Income provide support as well. And there are a lot of different resources that are out there. Now, I'm not saying that these resources are always perfect, that the outcomes are, great, but they are available and they can support you in the way or try to support you in the way or in the area of needs that you may have. It may not be perfect, but stabilization is possible. Stabilization, right? Um, let's see what else I want to share with you, amazing people. So I hope so far all of this information has been, have been very useful or can be useful in whatever way you choose to, whether share, educate, and even apply. That it will bring about positive changes in the way that you're living life. Choose to live life, okay? I know that there are things that we all experience in life that we didn't ask for, but we have a choice to make. We can choose to enjoy, so many beautiful aspects, or we can choose not to. I hope you choose to enjoy it because you deserve that, right? You deserve it. You deserve it. Why not? Okay, so I've already talked about resources, even family, when it comes to family support, right? I talked about resources for the patients earlier, someone who's diagnosed with schizophrenia. But even for family who are supporting someone who's diagnosed with schizophrenia, the National Alliance on Mental Health, Mental Illness, they have a lot of family support groups. They're free peer led support groups for family members, and it provides a space for you to be able to share your experience about what you're going through and also be able to gain coping strategy to support yourself and your loved one, right? The National Alliance on Mental Illness Family to Family program is an 8-week educational course that teaches families about schizophrenia, communication skills, and also self-care. And you check out their website and their information and resources. The counseling therapy for families, many mental health. This is a platform that provides therapy for families to better understand the challenges that come with, their loved one being, diagnosed with schizophrenia, and also how to better cope around the diagnosis and support themselves and also the individual. There's online platform therapy if one is not able to do face to face. You have different other therapeutic platform as well to seek therapy, if one needs to be able to support yourself and also a family as well. Crisis and emergency support, as mentioned earlier, 988 24/7. The Harris Center for Mental Health is in Houston, Texas. It offers 24/7 crisis intervention and emergency mental health services as well, right? So knowing your local mental health authorities and also the services that surround that agency to be able to support you. Educational resources, the Schizophrenia and Psychosis Action Alliance. It provides education about schizophrenia and advocacy and policy changes around, mental illness. Policy changes around mental illness. That's really important as well, right? Because it impact fundings, it impact resources that we put out for our patient. It impact, how patient continue to get the support that they need when it comes to treatment and a lot of the other things that they may be needing as well. Let's see. Let's see. Respite care, right? So there's also respite care for family who may need some support to rest. Okay. So you, even though if maybe, you just want some time away to, go find a friend and you need someone to come into your home to support your loved one for a second, there are respite care as well available as well. Let's see, am I missing anything? Okay, so if you are diagnosed with schizophrenia and you are in a crisis, what to do? If you're diagnosed with schizophrenia and you're in a crisis, if you're diagnosed with any mental health disorder, or if you are in a crisis in general, right? And you are diagnosed with mental health disorder, panic attack, uh, you know, you're going feeling depressed, you're having suicidal thoughts, you're having thoughts of self-harming yourself, or even if you've already started to do those things, please seek immediate help. Call 988, which is the suicidal and crisis lifeline, which is available 24/7, and they provide free confidential support from trained clinicians, right? And they're not robotics. They're not robots. I know many times people are wondering, are these robots? They're not robots. I've worked behind the scene and I've actually interacted with people and supported them in those space. And I've been asked if I was a robot, but I'm not a robot. Okay, so reach out to those support services that are there, right? Go to the nearest emergency room. Let them know what you're feeling, what thoughts you're having. Don't be ashamed. I know sometimes it feels like you're alone and you're the only one feeling this way and no one understand. Please share those thoughts so that you can get the support that you need and that you deserve, right? Be honest about how you're feeling, the symptoms, and how they're showing up for you. And if there's an immediate risk of harming, visit an ER for a professional assistance, right? Contact someone immediately. Tell someone you love. Tell someone to drive you to the hospital. Tell someone to call. Tell someone to remove things from you that could be harmful, whether it's gun, whether it's knives, whether it's anything that you could use to harm yourself, blades. Remove those things so that it reduces your chances of harming yourself. So lock it up, put it away, put a distance between you and that item or those things. When those thoughts come, find things to distract yourself, play with your dog, go for a walk, call a good friend, get help immediately so that you can be safe, right? Because at the end of the day, you are important and your life matters and you make a difference and you're here for a reason and for a purpose. And that purpose, nobody else can fulfill it but you. So you matter. So seek immediate help. Reach out to a trusted person, contact a family member, a friend, a support system, someone that can help, right? Like a psychiatrist, your therapist, a guardian. A lot of times when you are in therapy, your therapy may develop a treatment plan for you in which you have like a DBT plan, which allows you to call if you're having these type of thoughts for a 5 minute, sessions for support, so that you guys can kind of discuss some tools to get back in place in supporting yourself and going back to enjoying life. So being able to utilize those safety plans that you have, not just creating them, but actually making it a living document that you use to support yourself each and every day, right? So reach out to a trusted, loving individual that you trust. Utilize your local crisis support system. The mobile crisis units in your areas, if that's something that you provide. Reduce any immediate risk, as I mentioned earlier. Find a quiet, safe space to reduce any sensory overload. If you're the type of person who get overstimulated by a lot of noise, get to a space where things are quiet so that you can have your thoughts collected. If you're experiencing any type of hallucination or paranoia, right? Avoid any type of substances such as drugs or alcohol, because they can worsen the symptoms, right? And if you're having thoughts of harm or suicide, like I said, remove any access or sharp objects or anything that is dangerous that will increases your risk of actually acting on those thoughts, right? And create, once you are stabilized, create long-term crisis prevention, right? Create a safety plan that will allow you to be able to support yourself when you start experiencing things that could lead to you escalating or those symptoms worsening. Talking to your doctor, family member, your caregiver, your psychiatrist, your providers, being in tune with your coping strategies, staying consistent with your treatment, taking your medication as prescribed, not when we're feeling better we stop, and when things start getting worked up again we start taking it, right? You have to take it as prescribed, because that's what the doctor has prescribed. And if you don't agree with it, talk to your doctor about it. Communicate your needs and your concerns. Like I said, your voice matters. This is your space, right? And attend therapy as recommended, and be able to apply the tools to be able to manage the tools, not just in therapy. Just don't show up in therapy and feel good for that hour and then the whole week is chaotic. Utilize the tools outside of therapy as well, and identifying triggers, right, early on, things that causes you to feel this way, the warning signs, to be able to track it, the symptoms, so that you are able to intervene before, like I said, things get worse or it escalates to a space where you're not able to support yourself. And there's nothing wrong with you reaching out to someone else to support you if you need it. But there are things that we can always do, is being able to identify triggers. What are the things that makes me start feeling this way or cause this, and then tracking those things down, so that when that situation or things happen, sounds or things happen, that I'm able to support myself in that space, so I don't escalate or go into space where I ended up hurting myself, or worse. So I hope that this information was informative, and I hope that it can help individuals, people, all of us, not just families who are supporting those who are diagnosed with schizophrenia, or loved ones who are diagnosed with schizophrenia, but us as communities, as individuals, as people, to also be aware about when we do see things in the community, how can we support one another as well, right? It may be we don't stand and stare. It may be we ask questions instead of assuming, or whatever the case may be, or maybe just stepping out of the way, if that's what's needed. So much love and respect to all of those of you who are, diagnosed and, every day struggling with mental illnesses. Your life is important, and you are not your mental illnesses. You are a person and you matter. And I hope that you're thriving every day to live a life that is fulfilling, that is filled with love, and that is filled with all of your happiness and purposes that you're intended to be in this world to create. And it's just so beautiful. So again, thank you for tuning into the human narrative. It's always a pleasure. My name is Dorinda. Much love and respect always. Mwah.